And you can zoom or whatever as you need to. All right, so as I'm getting ready to perform a Foley on my patient, I am going to make sure that I have my Foley kit, first and foremost, that I have in order, and that I have probably a towel. I need some washcloths, things like that. Make sure that my patient is clean first, okay? So I'm gonna get me some gloves, just regular gloves. And a lot of times what trips people up on this is that we are not thinking about what we're actually doing here and what's important. So in this scenario, what is important? We said that I don't want to introduce bacteria into my patient's bladder, right? So what do you think is important for me to maintain sterility of? Most important. My hands, right? Because I'm touching everything in there. What else?
The area.
Okay. His penis?
Mm-hmm.
Yep. Okay. What else?
The actual catheter.
The catheter that I am inserting into his bladder. I would say all of it has to be sterile, right? But most importantly, that is what I'm going to make sure that I'm being very cautious of and that I am not contaminating. Okay. So when I get ready to go insert, I'm probably going to lose my jacket. Even in real life, I would lose this because it's going to be moving and getting in my way and I'm not going to be able to touch it, okay? So I have my gloves. We went through the whole procedure. I'm just going to go get into the Foley, okay? Making sure that I am not exposing my patient until I am ready. And really, I'm cleaning him first because I want to make sure that there aren't any there's no stool or urine or anything like this that's going to potentially contaminate my field, okay? So I would get me some washcloths, clean the peri area, make sure he's all clean. You could put a brief down here, that's fine, that he has a clean brief prepared for when I'm done, okay? And then I'm ready to start my Foley. So I would get rid of these gloves and I'm going to just throw them in the trash. And a lot of times what students get hung up on is being cute and proper and like wanting things to be straight and pretty and all of those things. And at the end of the day, this is trash, right? I don't need to be cute with it. I can just throw it away. So I can get me a trash can. I can use my little Foley bag here. Whatever I'm gonna do, just to throw trash away, okay? Next, I'm gonna open my bag. Now, what I try to do when I open this is I try not to touch in here. So just in case I potentially come into contact with that again, that I'm not running another risk of contaminating myself, okay? So I get my kit out and I'm going to place it in the bed. Now, some people start on the bedside table, and that's not necessarily wrong, but then you're gonna have to move your sterile field. So I find it easier, unless my patient is combative, or maybe they can't move their leg or their hip and I can't place it between their legs, or they're confused or something like that, that might not work. But for the most part, I'm gonna place it between their legs. Most of the time, I'm gonna have somebody come in here with me to help, and I'm just gonna have me an extra pair of sterile gloves, just cuz, right? Just in case something happens. And so if somebody needs to hand me something, they can. And if I contaminate and need a new pair of gloves, then I can do that and it's not a big deal. Okay, so I'm gonna make sure my patient is spread out. I have my bed up. And to open my kit, I open it away from me. Then these two sides would be next. I open this way, I open this way, and that shouldn't happen. And then I'm gonna open it towards me. And that's important because I don't want it to fall back on itself and contaminate, okay? So I'm going to get my gloves out over here, okay? To get my gloves out, I'm gonna pinch, okay? I'm just gonna pinch the top of this and I'm gonna move them either on the bedside table, on the side of the bed, and most of the time I'm gonna go to the bedside table and I would just ask my assistant to watch my sterile field for me, okay? But in this case, we're just gonna say, this is I would not do this on the patient's chest, but let's just say this is the bedside table. You could also, you have an option here, so I'm gonna give you an option. You could next get your drape, hold it by the outer inch only, and then drop it down here. But I can't touch that because I'm not sterile, okay? And so that's fine if you want to do that. That's not typically what I do. But I'm not gonna be able to touch that aside from that outer inch, okay? And so I could go in here and fix that, and that's that, and that works, it's fine. But you need to leave it alone. It doesn't need to be cute. It doesn't need to be pretty. It doesn't need to be folded. Why did I put this down? What is this for? Take a guess.
Your sterile field.
Okay. It's an extension of my sterile field. What else? What potentially could get on it?
Isn't it there to like if for any drainage or like leaks or anything?
Such as urine?
Yeah.
Or something? So do you think it needs to be folded pretty and proper in the event that urine might get on it? Probably not, right? Not the huge focus of this. Okay. We're gonna rewind and pretend that wasn't already there. Okay. I'm gonna put my gloves on. I've opened my kit. I've got it open. I pinched my gloves up. I'm over here. I'm gonna put them on. Okay. Now it's very important that you get this straight out because they will fold over and contaminate your gloves before you ever even get them on. So try to flatten that package out, and then I'm gonna put them on. Okay. I pinch up by the cuff because that's the part that I can touch. And I'm gonna slide them on. Okay, I'm not trying to be pretty and cute with the gloves. I don't need them to look perfect. I need them to cover my hands, right? So I'm gonna drop it and I'm gonna leave them alone. Then I'm gonna go under here, under that cuff, and I'm gonna put on the other hand. Okay. I don't need it to be pretty and cute. I don't need it to be perfect. I need gloves on my hands, okay? Once I get those on, I'm gonna do this because my instinct is going to be fix my shirt, touch my glasses, fix my hair, whatever, and then I contaminate, and then I've ruined it, okay? I'm gonna come over here to my field, and I'm gonna get my drape. Now, if I'm doing the drape after I have my gloves on, I'm going to need to protect my hands, okay? So I'm gonna open this up, and I'm going to fold my hands under here like this and cover them to protect them, okay? Once I have that, I'm gonna come onto my sterile field, and I'm just going to put this down and get out of there. I don't need it to be pretty and cute. I don't need it to be straight. I need to sit it down, okay? I'm gonna get my next drape. I'm gonna open this up, and I'm gonna drop it. Now, I've had students who said their teachers told them not to do this, that you just get rid of it. A lot of times, like with a female, it might be easier just to get rid of it. But with a male patient, this provides me another opportunity for if my hand actually accidentally touches here, it's sterile and who cares, right? And it's just another means of protection. So if it's easy, if it works, use it. If it's going to hinder you or mess you up, it's not that big a deal. All right. Now I can get this and just kind of get my stuff situated how I want to. Okay. So I'm going to open up my solution. I'm going to pour that out. This is not cooperating with me, but it'll be okay. I'm going to open up my lubricant, and your book says that you're going to insert this syringe of this into his penis. I'm not doing that. That doesn't seem comfortable to me. But if you want to do that, supposedly that's what your book says you're supposed to do, okay? So I would squirt this out and put it in here, all right? I can get rid of that. Then I have my syringe. I'm gonna go ahead and just attach this. And it used to be best practice for us to inflate the balloon. They say don't do that anymore. Not to check it before you insert it, because you can actually like compromise the integrity of the balloon. So you don't need to do that supposedly anymore, okay? Next, I'm going to open up my catheter, which we said is one of the most important parts of this, right? So I'm going to make sure that I'm maintaining stability of this. And I'm going to put it in my lubricant, okay? And you see how it's kind of like stuck a little bit and it's not moving as much as I would like it to? I'm going to make that where that's not the case, because I need this to be stable, okay? And not go away. That's good. Can you do me a favor, my little helper? Can you just hold that open for me? Perfect, okay? Now I'm ready and I'm about to contaminate my hand, okay? So I'm going to hold here and I'm going to start cleaning. Now, what I always see students want to do is we're cleaning over here and all this. Where is the catheter going? Right here, right? So where do you think I need to clean? Right there, okay? So I'm gonna start here and then I'm gonna clean, okay? If I cross over my sterile field here, I'm contaminating. So I'm gonna come back and I'm gonna go around and I'm gonna chunk that, okay? I'm gonna come here, I'm gonna clean, I'm gonna go down, back, around, chunk that. Here, clean, around, chunk that, chunk those. Okay, now I'm ready. So I'm going to make sure it's good and lubricated and that I have a good hold on it, okay? All right, sir, I'm getting ready to insert your catheter. It's gonna feel a little uncomfortable, okay? I just need you to take some deep breaths. I know, I'm so sorry. Deep breath. There you go. Okay, I know it'll be over in just a second, okay? Hopefully it'll feel better after we get it inserted. I'm sorry. Okay, and I'm gonna go all the way to the bifurcation here because I have walked into several patients' room who have a Foley bag filled with urine because somebody inflated the balloon in the man's prostate, and we don't wanna do that, okay? So I inflate my balloon and I make sure I keep this held before I disconnect this, or else the water's just gonna come back in here, okay? So I'm gonna keep this down, disconnect, and I don't need to be sterile anymore. I'm done, okay? So I could change my gloves or I could just continue. I'm gonna pull this out. I'm gonna make sure that I tape this where he has some room. Your book says to tape it to the abdomen, but I would say just whatever's comfortable to your patient. Just make sure that he has some slack because you wouldn't want it to be like applying pressure, okay? Here, and then I hang this on the actual hook on the bed, not on the side rail, okay? Now, if I needed to get a sample right now, and I just inserted this, I'm going to just go ahead and get it out of the bag because all this is sterile, it's all brand new. If I'm coming back later and I need to get a sample, I'm going to pinch this up, twist, clamp that off, and I'll wait a little bit, okay? Then I'm gonna come with my little tube and I'm gonna have a syringe with a lure lock, which I don't have, but it's the one that has the screw end. I'm gonna scrub with alcohol here. I'm gonna connect to my syringe, and then I'm gonna draw up urine that's coming from his bladder, okay? And then I'm gonna insert it into here, and then I can use this sample, okay? For a female, the only difference is going to be, as we said, this can be a little trickier, okay? if I have a female, okay, if I have a female, then once I'm putting this on, you need to visualize where you're going to have to insert the Foley before you get started, because it can be a lot more difficult, and you're probably going to have to like position her accordingly. And so that might make this a little harder, but you can see here that I can access it. It's not a big deal. Okay, so when I'm getting ready to clean her, I'm going to have to spread her labia, and I'm going to have my hand here. And so I'm going to clean one side, come back around, chunk it, clean the other side, come back around, chunk it, and clean the middle. Okay, you want to make sure you're being gentle because the skin down there is really sensitive and can rip. So I'm going to clean, and I'm going to get rid of those. When I get ready to insert, make sure it's good and lubricated. Make sure I'm maintaining control of this. And it's probably going to look like a little wink or like a little slit instead of a hole, okay? And so I'll see that, and sometimes it might be off to the side, and I'm going to insert it into there. Now in a female, I'm looking for that urine return to be like kind of my guide of I'm in the bladder. But I teach students just to go ahead and go to the bifurcation with the women also, just so you don't forget. Because it's not going to stay in there. It's going to come out to whatever length it needs to be. Insert. That's not going to work because it didn't go in, but inflate my balloon. Grab it, get it out of there. Okay? And that's that.